Lean on me. With that, you should know that this program coming up is going to be a very good program. So good afternoon, our dear listeners, and welcome to See Something, Say Something program brought to you by C-Advocate Newspaper and TV in partnership with SeeSay FM and the Ubewanne Foundation. You know, where we speak up for those who have not or who have given it their all, so that today they will know that someone is speaking up for them. My name is Esther Anoa, and today we are diving into a topic that concerns every family in Imo State. And it's a topic that we've been talking about since last week called geriatric care. But this week, we are going deeper into it. We're going to be talking about who is best to care for the elderly and the modalities to care for the aged people. So whether you're a son or you're a daughter or you're a caregiver or a nurse or a community, leader, today's conversation is exactly and directly for you. So yeah, every day, across our communities, an elderly person is somewhere sitting down alone. And an aged father is waiting for someone to get his drug, but that person is not there, right? So, there are so many situations like this, and it happens every day. The struggle to do things, to get their medicines, to get a cup or even to pick up a spoon. It's a difficulty. So, and we live in a world that is moving so fast. Children, they relocate abroad. Everybody is outside. Children are outside. Everybody is elsewhere. They're in other states. They're in other parts of the world. And then families, they're all scattered everywhere. Your nephew is not around, your cousin is not around, your brother is not around, everybody's scattered, and then the aged ones are too often left behind. That is the truth. They are often left behind because nobody is around to care for them. But yet our culture is taking care of the elderly. And it's not just a duty, it's an honor. It's something that is sacred. It's a responsibility that is sacred. So the question is not whether or not to take care of them, but the question is, who is best positioned to do and how? So today we're privileged to have a distinguished guest in the studio, someone who brings valuable insight into the care and well-being of older persons. So I'm just going to let her introduce herself.
Okay, my name is Kano Doris, and I'm a healthcare giver, a geriatric caregiver, and also a counselor.
Wow. You're a counselor?
Yeah.
Right, that's huge. That's so huge.
For the elderly, of course.
Okay. So, Ms. Doris, I'm going to ask you some questions because this is something you do. This is something you already know. So I just want you to tell my people, tell my listeners what they need to know concerning who is best, positioned to take care of the elderly. Can you just give us an experience? This is your thing, right? So give us an experience you had while working with older persons.
Okay, like I earlier said, my name is Kano Doris, and I'm a geriatric counselor and also a caregiver for the elderly people. And my experience working with the elderly people has actually been both professionally rewarding and, of course, meaningful, in the sense that I've done a lot of caregiver job across different settings, both for the home care, the community support programs, and also assisted living environment. And also I have provided help or have supported individuals with aging conditions, such as people going through dementia, hypertension, arthritis, and of course diabetes, and also stroke. So, and in my daily experience as a geriatric caregiver, I have assisted them in their activities of daily living, such as dressing, bathing, feeding, and of course, the mobility support aspect of it. I've also provided emotional and psychological support, helping clients cope with their loneliness, grief, and of course, loss of independence, which is most of the things that the elderly people suffer. I also have the experience of monitoring vital signs, ensuring medication adherence, which most elderly people find difficult in doing, and also collaborating with healthcare professionals and of course family members to provide holistic care for these aged people. I've also prioritized healthy lifestyle in terms of ensuring proper nutrition for them, and also light physical activities and social engagement to help their cognitive memory. Then I think in all of this, the most important part of my experience is practicing patience, empathy, and of course effective communication, especially when I'm dealing with individuals or older individuals who has cognitive decline.
Wow, one would look at you and know that you are involved in so many things, and something that is as important as geriatric care. Like, many looking at you don't know that this person is doing a lot, and I really want to commend you for that, honestly.
Thank you.
So, in your own or in your best opinion, who do you think is best to care for the elderly?
Well, I would say it involves a lot of people.
Okay.
Let's say, for instance, the first people that are actually best to care for these aged people, I would say the family, because they are the primary caregivers. Okay? The family, they help provide and promote comfort and of course independency. So when I say family is involved, and of course the healthcare professionals, let's say the caregivers. Okay, for some people who have caregivers who come to their homes to actually care for them, it helps create that independency in them, and of course promotes good comfort for them. Then I think secondly we'll say the trained caregivers, that is the professionals. Okay, yeah. This has to do with people who has the geriatric knowledge. Okay, in terms of knowing how to manage these elderly individuals. They help them in their daily activities, which is the bathing, dressing them up, and helping them in mobility support. They also help in their physical and vital sign monitoring. Then we also say, look at the healthcare professionals. Now this has to do with the trained geriatric doctors, the nurses. Okay, now these people ensure that the medical conditions of these aged people are being taken care of. They take care of them, they monitor their health challenges, they make sure that they gain their balances. And you also have the physiotherapists, and of course the occupational therapists, and also the social workers involved in that aspect. Then we'll begin to look at the social workers and of course the counselors who help individuals who has mental issue. They counsel them, they put them in check, they make sure that they are in check. All right, and you know, it helps in their cognitive stimulation and all of that. So then we look at let's say the community also is involved in caring for the elderly people. The community and also the faith-based organization. These people can actually help the elderly people, get them engaged in social inclusion. That will also help them in you know, finding good reason to live again.
Yeah, I agree with you. Families are supposed to be the first person or the first people to do that, because I mean they're the ones providing the financial aid and everything, because I mean who's going to take care of your parents if there is no money, if there is no emotional support and all of that. But it's good to also know there are other persons in line, because everybody has a role to play, right?
Exactly.
And I think this is going to be like something that the family members are going to be so happy with, because at the end of the day it can be overwhelming, like having only the family person taking care of the elderly ones. And I think knowing now that there are people that can come into the play, and then they have their own roles, and everybody's doing what they're supposed to do, then I don't think there should be any issue about having the aged ones that are looked down, or the aged ones that are not even looked after. Because when everybody's playing their role, then everything goes in line, right?
Everything goes well, yeah.
Good, and that is good to me. That's good. So from your perspective, what does quality care really mean? Some persons will say quality care, but it's not just to send money. It's not just to send home. It's what exactly is this quality care that should be given?
It's not just about sending home, but money home and all of that. From my perspective, I think quality care for the elderly simply means providing care that actually meets 1, the physical, 2, the social, 3, the emotional, and 4, the psychological aspect of care for the older people in a safe and respectful manner.
Oh, in a safe and respectful manner.
Exactly.
So if just sending money and just doing this is not in line with all these things you just mentioned, then it's nothing, right?
Yes, it's nothing.
That is good. That's good. Earlier you were talking about challenges that
because
people face.
I really do not think that it's all about sending money to your parents and not following procedures.
Procedures, right?
You understand?
Okay.
You should send money. You should make sure that the money is being used. Like most of our elderly individuals in the rural area, you send them money to say, okay, get this medication or do all this, that. But you know, they want to just put in that money into something else. For the ones doing farm work and all of that, someone like my mom, anytime I send that money home to get medication or go for proper healthcare checks and all of that, I follow it to the later.
Right.
Like I make sure I follow it because she will tell you, oh, this money I used it to hire a laborer to come and do work at my farm. No, it's not just about sending money. You make sure that the money is used for that's the same purpose in which you sent it for.
You know, coming from you, who is already someone who is practicing geriatric care, they should also know it's not just for someone who knows what it means or what the importance of it. Everybody should be involved. When you send money, you follow it up. Simple. So, yes, earlier you were talking about challenges that elderly ones face. You're talking about Alzheimer and the rest of them. I mean, some persons will be like, it's not just, they call it old people sickness.
Okay.
They have a general time they give it old people's sickness. But as a professional, right, you should like, there should be a name given to all these challenges. Like you talked about Alzheimer's, right? Some person might say, okay, what's even Alzheimer's?
Well, there are a lot of health challenges when it comes to the elderly people. They have several complex health conditions, which a lot of people just mistake it.
Yes.
Okay, for something else. Let's say when you see an elderly person, you definitely maybe you find somebody who has dementia. Okay, that has to do with the cognitive aspect of that individual. Okay, and that has to, the early symptoms could be forgetfulness, maybe difficulty in recognizing a loved one.
Oh, that is bad.
The confusion aspect of it and wondering, you just see the person is just moving, pacing from this one end to the other, and you're wondering what is wrong with this person. And you start yelling at the person, which is a wrong thing to do. Then you talk about the hypertension aspect of it. Talk about diabetes, the constant urination. Of course, you should know that.
Yeah, that one is common among aged ones,
of
right?
course.
Really
Then
common.
you talk about the stroke. When you don't start having the face dropping, okay, you see that this person is normal, and at some point you start noticing some changes, deformity in that person, and you will not take the proper step that you're supposed to take because you do not have those. Maybe you start taking the person to the church and say, oh, it's a spiritual matter. Hey, my enemy has done this. No. These are early signs of stroke. It could be the slump speech, the person start having issue with speaking and all of those things. These are just the early little signs of, oh, there has to be an immediate attention given to this particular person.
So, talking about procedures, let's just put some things clear so that some persons will get it straight to their minds. How often should elderly individuals go for medical checkup?
Well, in that aspect, it actually depends on the kind of illness and the seriousness of the sickness.
So it's not just headache, you carry them to
no,
the hospital.
It's not just headache, you just take them to the hospital.
Okay.
I mean, for those with just minor issues, okay, they could just do their check maybe once in every year, like once in 6 months every year, 6 to 12 months. Then for people maybe with chronic illnesses, like something you know that this one is a very, very serious case. All right, let's say between 3 to 6 months. Every year that person should actually get checked. Then for people going through a regular check, like you have cancer or prostate cancer, cervical cancer, it should be on early check, like regularly. You should be able to check yourself regularly, and maybe from your doctor's prescription, doctor could say, okay, come for the next check in 2 weeks time, based on the seriousness of the illness that the person is facing at the moment. So it just differs.
Some persons will be like, I have money, just go, I've paid your insurance, go every 2 weeks for checkup. And then you find that you're wasting money or you're spending money on something that might not be that serious.
Yes.
And then when there is need for something that is more serious, maybe the finance is no longer there, right? It's good. So we need to get this in straight.
And I think people should just learn how to manage pain. Okay. I think people should be consistent with regular check because it really helps. I mean, you might just have a minor issue, and it's something that little medication could just solve,
okay.
right? But because you're scared of what might be the outcome of you going to the clinic,
yeah,
or the high cost of medication consultation and all of that, which is one of the challenges that the elderly people are facing, you will just relax and just
let me
do
put it there.
anything.
You know, some elderly ones are scared to go to hospitals. To be honest, you know, when there are people send money, they're like, hospital again, it's just headache, you know, that kind of thing. So because they feel their children don't understand that, okay, it's just like this, it's not really like this, they then, you know,
want to
deviate from the main things they're supposed to do, right? And that's something that everybody should put in mind. Yeah, put in consideration that these people, they are still human beings. If it's where you going to hospital every day can also be sickening and tired and all of that. So yes, that's a very good one. So that is Miss Doris, and she has told us straight up what it means. Because I don't think there's anything I've said here that would have been better than what she has given us, right? So on that note, we will go on a short break, and when we come back, we will take your calls. Thank you.